So hi doctor,
Hi.
as we are talking about Botox today, my very first question arises, what is exactly Botox and how does it work?
So Botox is the brand name. It is a neurotoxin called botulinum toxin A, which is derived from a bacterium.
Okay.
So how does it work? Botox actually is used to relax muscles.
Okay.
So it's generally injected into the muscle, and that kind of blocks the activity of acetylcholine, which is a neurotransmitter. So acetylcholine actually helps contracting the muscle. So if you block it, it will relax.
Okay.
Right? So in areas that we use Botox are muscles of relaxing, that contract. Like for example, forehead, when you have forehead lines, or when you're frowning, you see these frown lines.
Yeah.
These are dynamic wrinkles that are formed over time. It's also used in medical purposes. For example, when people have excessive sweating under their arms or palms or feet. Also for people who have migraines and also overactive bladders.
So doctor, as you mentioned, some of the areas where Botox can be done. So what are the other areas on the face that Botox can be injected, and what are the commonly treated areas for Botox?
Okay. So I did mention forehead lines, right? That are formed on your forehead.
Yeah.
So the other areas are like the frown lines that I mentioned, the glabella area.
Okay.
So some is injected there so that it doesn't look stern. A person generally, they look angry when they're constantly making that expression. Obviously, when a person smiles, crinkling, there's a little bit of lines that they form around their eyes. So Botox is used for that as well, makes them look a little bit awake. And Botox can also be used for a lip flip. So a little amount is given just over the lip, very superficially, and that gives them a little bit of a lip flip. Especially for, I think, people who want to see how fillers are going to look, but don't want to get fillers done. So generally we do that just so they know what it actually looks like.
All right.
A little bit at least. Then the other areas would be if a person has a very squarish jawline, around here. So for masseters, so these are muscles here, like when you clench your teeth, you would feel them. So certain people have very, I would say, bulky masseters.
Yeah.
So we can use Botox here just to slim it down a little bit, so they have a bit more of an oval face.
All right.
Yeah. Another area that we do use Botox in is around the chin area. So as a person gets older, the chin kind of pebbles, like an orange peel.
Yes.
It also turns a bit upwards. So we use that to relax this muscle.
All right.
A little bit. So they have like a nicer looking chin.
I guess fine lines too, I guess?
Fine lines would be a bit more superficial, I would say.
No, smile lines.
Or smile lines, these. Yeah, those fillers. Generally,
Okay.
we can't give it. Botox is not for filling, it's generally to relax muscles.
All right.
The other area would be a Nefertiti neck lift. So we have these platysmal bands in our necks. So these sort of pull your face downwards, the muscles downwards. So when these are relaxed, the face looks a bit more V-shaped.
All right.
Yes. So these are some of the areas we use Botox in.
So basically, can you exaggerate who is the ideal candidate for Botox?
So great question. For people who are looking for Botox to achieve a natural result, with expectations, and obviously who have dynamic lines, those are ideal patients. Anyone above the age of 18 is an ideal candidate. That depends again if it's dynamic movements of their lines, or is it static lines. Anyone who is breastfeeding or is pregnant is not the ideal candidate.
Okay.
Yes. So there are a few people who are not ideal. Anyone who is who has a neurological condition is not an ideal candidate, or anyone who is allergic to botulinum toxin or ingredients in Botox.
Okay.
Shouldn't be taking Botox. So these are some of the candidates who are ideal or not.
So one day I was scrolling through internet and I got to know someone was talking about baby Botox. So can you shed some light on this topic?
Okay, so basically preventative Botox is used for people that, when they start squinting or smiling, you start seeing these tiny crow lines or wrinkles developing in the side corners of the eye. Or if you're lifting your eyebrows, if a person is lifting their eyebrows, then you will see dynamic lines, we call them, that are formed when lifting eyebrows. So to prevent these lines from becoming static and permanent over time, we use some preventative Botox.
Okay.
That's what we call that. And baby Botox is actually sort of preventative, but in much lighter dosages. So we
Alright.
dilute Botox and give the dosage in very like small quantities, so as not to give them a frozen look. Not like we would give a frozen look with preventative Botox as well, but it's for people who don't want to commit as much, or is a person is a
Beginners.
first timer, exactly,
Okay.
or they're beginners, and they just want to test it out. So that's what we call baby Botox.
All right. So, doctor, as you said, baby Botox is generally for those who are beginners. So, someone who is considering Botox for the very first time, what should they know before their treatment?
Another great question. Well, for somebody who's considering Botox for the first time, you need to be well informed.
Yeah.
So
definitely.
first is obviously check that you're getting it from a licensed professional who is board certified, has a medical degree.
Yes.
Then look at their before afters, ask them to show them the before afters with Botox. And of course, don't feel shy about asking questions.
Yeah.
Any questions that you have, they have to be taken care of. Second is obviously taking consultation to get to know everything about what you're getting done, what your goals are, so that the person who is injecting you would know what you like to achieve, right? With Botox, even for the first time, there is no downtime. So don't be afraid.
Okay.
You start seeing results in about 3 to 5 days. Do not touch the area that's to be injected or rub that area to be injected.
Many a times, Botox is a treatment that is considered very expensive. So, what are the factors that determine the cost of Botox treatment?
That is true. A lot of people do think that Botox is very expensive.
Yeah.
But for the results, I don't think so.
Yeah.
But there are a few things that you need to. First of all, it'll depend on the number of units you need.
Yes.
So that will multiply. Like the cost is per unit. For example, if you're doing just one area, it won't be as expensive if you're doing the entire area.
Yes.
So, and also depends on the provider that you go to, what toxin they're using, botulinum toxin. Obviously, there are different brands, various brands. So if you're buying something from a reputed brand, it is going to be a bit more expensive. But you know that there are basically no adverse effects with the reputed brands. And if you're going for cheaper brands, maybe you don't know if there are going to be some side effects where it's been made. So those are important points to think about. Another thing is who's injecting you. Now you can give a normal person a paintbrush, and then you can give an artist. They would draw something completely different. So it's an art also to inject. So basically, who's holding the syringe is very important. Obviously, it has to be licensed professional. Number of years experience would also count, obviously. So those are some of the, I would say, points to take into account while getting Botox injections. And the pricing will depend on the brand you use and your injector mainly.
Doctor, as you were talking about the side effects, what are the common side effects we see after Botox, and what is the most important aftercare?
Okay. Yes, so obviously if you're getting any sort of treatment, you do need to know if you're going to get any adverse reactions, if they're minor, major, or aftercare. So let me start with the minor adverse events or side effects that I was talking to you earlier.
Yeah.
That is bit of mild swelling.
Okay.
Yes, around the injection point, which is very common. There might be slight bruising, especially if we're injecting around the eye. A person might feel a bit of tightness or heaviness on the brow.
Yeah.
That's if you're going with large doses around the forehead. These are very mild adverse effects, I would say, and they go away in a couple of days.
Okay.
So major ones would be ptosis or eye droop.
Okay.
Yes, that's if Botox is injected and it sort of migrates to a muscle around the eye. That can be a slight droop. So none of these are very, I would say, permanent.
Okay.
They go away in a couple of months' time.
All right.
Another one would be if a person is getting very large doses around the neck area. Like I was talking to you about platysmal bands, right?
Yes.
So if they're getting very large amounts, they might have a little difficulty in like raising their head or a bit of swallowing, which again goes away in a couple, 2-3 months. They're not permanent at all.
And what can be the aftercare for this?
Okay, so aftercare, obviously, don't use any actives. For example, any acids. like glycolic acid, lactic acid, any retinols, AHA, BHAs basically, because
Alright.
your injection points are fresh. They take anywhere about 8 hours to 24 hours to shut completely. So we don't want any sort of infection or irritation around that area. Number 2 is stay upright for about 4 hours, meaning no lying down on your back for at least 4 hours post-injection.
Okay.
So that, your Botox doesn't disperse around that area more than necessary. It stays in that area where it's been injected.
Okay.
Another would be avoid alcohol for the next 2 to 3 days. And drink a lot of water. Stay away from swimming, sauna, steam for about at least 24 to 48 hours to decrease or minimize risk of infection.
So doctor, one of the most important question is, how long does the Botox effects last?
A great question again. So the effects of Botox will depend from person to person. Generally, it's about 3 to 4 months. It lasts around that long before you need another treatment.
Yes.
But for a few people, it wears off much faster. Some require it after 2 months even.
Okay.
Yeah, so if you're first timer, generally it wears off a little sooner, quicker, because then later on what happens is the muscles, they start to relax in subsequent treatments. So like I said, it depends from time to time, and areas too, like areas that are more dynamic, yes, they tend to wear away a little faster than other areas.
So doctor, at what point of aging journey should someone consider alternative methods for Botox if someone is too old for Botox?
Well, I don't know if a person is too old for Botox, but yes, Botox alone is not going to help in the aging journey. You need complementary, treatments as well. For example, if even after Botox treatment, the line is still static, meaning you do need something like lasers or microneedling to help. If a person has a hollowed face, like there's a lot of hollowing or volume loss, Botox won't help in that as well. A person might think about, would require probably something like fillers.
Okay.
And if it's texture, again, Botox is not going to help with that. You need something like microneedling, growth factors or exosome treatments, perhaps some laser resurfacing even. So generally, in an aging journey like you mentioned, Botox standalone is not enough. You need Botox with other complementary services to help a person look a bit more refreshed.
Understood.
And youthful.
Yeah. Thank you so much, doctor.
Thank you.